Hello and welcome to Wellbeing. I'm Graham Wilson. A couple of years ago, we had on the program nutritional psychiatrist Dr. Drew Ramsey, who was talking about how what we eat affects our mood. In fact, he wrote a book on nutritional psychiatry called Eat to Beat Depression and Anxiety. In the interview, Dr. Ramsey cited a study being done at the University of Technology, Sydney, that assesses the effects of a Mediterranean diet on the symptoms of depression in young men. The lead on that clinical trial was Dr. Jessica Bays, postdoctoral research fellow at the National Centre for Naturopathic Medicine in the Faculty of Health at Southern Cross University. Welcome to the program, Jessica.
Hi, how are you?
Good, thanks. Can I just play you a little of what Drew Ramsey said? He was talking about the benefits of eating more of certain foods like nuts.
A lot of people worry about calories and things like nuts, but, a nut, which is fiber, slow-burning carbs, protein, and fat, is like perfectly designed to keep you satiated and full. And so, again, one of the techniques that we use in our clinic, it's been used in some of the recent research trials, actually a wonderful trial done at the University of Technology in Sydney by Jessica Bays and David Sibris. I actually just have an interview coming up with Jessica, getting released any day now. She did a trial of 72 young depressed men in Australia, a really landmark study, first time ever that anyone had studied using food to treat male depression, and it's one of the only studies ever in history that is focused on male depression. And they found a few surprising things, Jack. First, they found young men with depression were really eager to change how they eat. They knew that they needed some help, and they were kind of thankful for the attention. Almost all of them changed how they ate. 36 of them went into full remission from their depression just by adopting the Mediterranean diet. And the reason I'm bringing it up is just, the way they did is more olive oil, more eating the plants they like. If you like broccoli, great. Start eating more of that. If you like celery and carrots and, kale, great, eat more of that. That if instead of pushing people to maybe first just, expand, to first start just eating more of those plants you like. And then the last was beans and legumes. That lots of lentils and lots of beans. These young men started eating lots of hummus and snacking on hummus and different plants and hummus. So they want to make that more of a meal, put a little olive oil on it, and, all of a sudden you've got a pretty filling snack. So those are some of the ways, I guess, a question of the dietary pattern. Most of the research says the Mediterranean diet, but that same type of data, looking at rates of depression compared to a dietary pattern, the same type of data exists for a Japanese diet, for a Norwegian diet. So it's really traditional dietary patterns is what we're looking for, and those are going to be full diets made up of some of the foods we've just mentioned, are looking for foods in those food categories, again, leafy greens, rainbow vegetables, seafood, nuts, beans, and the seeds, and fermented foods.
Jessica, can you tell me what inspired you to explore the link between diet and depression?
Yeah, absolutely. So it's always something I had a really keen interest in. And I'd seen my younger brother go through depression, and I knew the struggles with wait lists for psychotherapy and treatments and how expensive that can be, and the very low success rate in some cases with antidepressant medications that are riddled with side effects for many people. And I thought there has to be a better option. Now, obviously, as a nutritionist, I was a bit biased anyway, that diet could be really helpful here. And there were two studies that had been done, mostly in older adults, that had looked at a Mediterranean diet and the effect that it had on depressive symptoms. And I thought, brilliant, that is what I'm going to do. I spoke to a lot of people before I did this study saying I want to look at a diet intervention specifically for young men with depression. And everyone said, brilliant idea, but that's unlikely to happen. Young men aren't interested in diet. You're going to find it really hard to get them to change their diet in the first place. Recruitment for clinical trials in men is really, really hard. So I had a huge task ahead of me. But when anyone tells me I can't do something, I show them.
So you focused specifically on young men. Was it just the fact that you'd seen your brother struggling with this, or was there something more to it?
Absolutely. So I, seen it in my personal life, my brother and a lot of his friends, and obviously I had been a young person at some point as well, and I noticed that in those around me. And men really, particularly young men, have reduced help-seeking behaviours and things like that. When we look at suicide rates in men, obviously it's very upsetting and that sort of thing. So this was a population that needed help the most, I felt.
Now, why choose the Mediterranean diet? Did you already know that the Mediterranean diet was helpful for mood?
Yes, that's a really good question. So firstly, obviously, the Mediterranean diet is delicious. It's easy. I didn't want something that was going to be really difficult. No one enjoys counting calories and feeling really deprived of foods that they love. I mean, that's not going to help anyone's mental health, feeling like all they can eat is celery sticks all day. So what I love about the Mediterranean diet is that it's really flexible. It includes really yummy food. It doesn't involve, only eating foods that are blue on a Tuesday. There's no silly rules or anything like that. It's something that's really accessible to a lot of people.
For those who are unfamiliar, what is the Mediterranean diet?
So the Mediterranean diet is a very sensible, healthy diet. So it focuses on lots of fresh fruit and vegetables, whole grains, legumes, obviously lots of olive oil, and a reduction in those sort of processed and packaged foods, high sugary snacks and things like that.
How did you design the trial? You had two groups to compare, did you not?
That's correct. So a lot of thought went into designing the trial because I wanted to make it as easy and doable and appealing to young men as possible. So we'd actually created like an advisory group prior to this where we had that demographic and we asked them questions, how many appointments do you think you'd be willing to attend? Would you find recipes helpful? Like, how can we make this as easy for you to do as possible? So that influenced the design of the trial quite a lot. And yes, we had a control group. So the control group was something called befriending. And this is used all the time in psychological studies as a valid comparison group. So that involves meeting with the researchers following the same schedule, so that the same time points, the same amount of time. And it just involved talking about hobbies and interests and things like that. And what that does is it accounts for things that can confound the study. So things like time spent with the researcher, attention, that sort of thing. They're getting that same level of attention, time, someone listening to them, that sort of thing, as the diet group as well.
Okay. Befriending therapy.
Correct.
So you were learning about the control group and also specifically targeting or listening for what the other group, the Mediterranean diet eating people, were telling you about their experience. Is that right? Yeah,
so both groups were very similar at baseline in regards to their diet and their mental health scores and things like that. They followed that same schedule, so they met at baseline at week 6 and week 12. The difference being the Mediterranean diet obviously had nutritional counselling where they changed their diet. The befriending group didn't change their diet, but just had those sessions where they talked about hobbies and things like that. And we measured the outcome measures at the same time for both groups. So we measured diet scores as well as mental health scores, quality of life, energy, sleep, that sort of thing. So it was comparable across all the time points.
Now, the subjects in the study, all of the young men, had they exhibited signs of anxiety or depression already?
Yes. So we measured their depression scores, which, like I said, were the same for both groups. And they exhibited moderate to high. That was part of our inclusion criteria for the study. So some of them were already on antidepressants and seeing psychotherapists and things like that. However, their depression scores were still significantly high, suggesting those things weren't really working for them. And we wanted to introduce these, the diet as sort of like an add-on, not saying it's replacing anything.
Was that difficult to convince them to eat different?
Yeah, so that's a really good question. So prior to this trial, the MEN study, we did another study before this, looking at the same population group. And we looked at their diet, and then mental health and associations between those things. But we also had a question near the end of the survey which said, would you be willing to change your diet if it might help your depressive symptoms? And the vast majority said, yes, I would be willing to do this. And that was a really, like a fist pump moment for me when I was analysing those results, because everyone had told me, as I said in the beginning, young men aren't going to change their diets. They don't care about diet. They don't care about healthy eating. They're not going to do that. And these results clearly showed that young men with depression would be willing to change their diet. They're willing to give it a go. And then that was then reflected in the amend study as well. They were very open to it. Many of them sort of had spoken to the researchers and said, yeah, I'm at the end of my tether, or I've tried so many different things. I'm not getting better. Let's give this a go. So they were very open to it.
Did you continue to measure depressive symptoms over time?
So we measured it over the course of the study. We didn't do a follow-up just because of budget constraints and that sort of thing, but that is definitely in the pipeline for future studies.
And how did you measure their adherence to the Mediterranean diet? Did any of them slip or not adhere to it as rigorously as they should?
So, yeah, that's a really good question. So we used a standardized, validated tool which measures adherence. So I asked some questions about, over the last 7 days, how often did you have blah, blah, blah. And what they did is they actually had a personalized link where they would fill that out at the end of each day so that we could monitor and track compliance over the whole course of the trial.
Did you get a sense of what the control group and the young men were eating before they went on the Mediterranean diet? I mean, was there a commonality across them all?
Yeah, so as part of the sort of inclusion screening, I guess you could call it, they did do a diet questionnaire then, so we could have a look and get a score for what they were getting. So both groups, like I said, had similar diet scores using this sort of general food questionnaire at the beginning. I think it was the CSIRO diet quiz, which anyone can go in and check, which is quite cool. Mm-hmm. And I think it was about 40 out of 100. So the CSIRO say on that quiz that sort of 70 is considered good. So a score of 40, which was the average across both groups, is considered poor.
How long were they eating the different diet, the Mediterranean diet? What was the length of the study?
It was 12 weeks.
12 weeks. And you saw striking results in that time?
Absolutely, we did. We saw a really huge difference. And we found an average reduction of, I think it was 20 points in the diet group for the depression scores, which is huge. When you look at that diet score that we used, it's one of the most commonly used scales to measure depression. It's called the Beck Depression Inventory. And usually in studies, when there's a reduction of sort of 5 to 7 points, we go, hurrah, that's a big difference. So a reduction of 20 points in that score is huge. We also found that 36% of participants in the diet group exhibited very minimal depressive symptoms by the end. So on that scale, a score under 10 is considered not depressed. So 36% had a score under 10 by the end of just 12 weeks.
Wow. Did the results surprise you?
Yes, they did. I thought it would have an effect. Even though we had got that pretty clear, yes, I'd be willing to change my diet answer from the previous study, I was still concerned about compliance, people dropping out, that sort of thing. When you look at studies, people drop out all the time, that sort of thing. But I think we only had 3 drop out, and it was because of clashes with schedule, and it was right within the first day.
Right.
So everyone basically continued the full course of the trial. We also did a feedback sort of study at the end where we asked them about their experiences, what they liked about it, what they didn't like about it, so that we could improve for future studies. And the vast majority, again, said, I would be willing to continue this now that the study is over. So I think that says a lot. It was very well received and made a big difference.
Did the participants describe the experiences, did they realise what effect their food intake was having on their bodies?
Yeah, so that's interesting. Often all of us are not particularly good at looking back and noticing things when we're in it, particularly when it comes to mental health. So that was another concern that I had. When you're looking at depression, you're looking at a population that generally has a low motivation, low energy, that sort of thing. And lots of the participants found it really interesting to see their scores over time because you kind of don't remember how bad you felt when you were in it. So going, oh, I didn't realise that 6 weeks ago I'd answered this for this question about my motivation. I hadn't noticed that I had more energy until you sort of look back retrospectively, which I think is really interesting.
Their own feelings, were they amazed with how the food had affected them?
Yeah, they definitely were. Some of the comments that were passed on from the researchers sort of saying how some individuals, they had described their depression as so severe that they couldn't work, they couldn't get out of bed, they didn't feel well enough to hold down a job, and then by the end of it, they were up and about, enrolled in university, that sort of thing. So just sort of those personal messages that wasn't really captured as official research data, but just relayed to the researchers was pretty profound.
Did you find there were any other improvements, like other areas of their health, physical or social?
Yeah, so we also looked at quality of life measures. So we use the World Health Organization quality of life sort of screener, which has different domains and categories. So it goes through things like physical health, social, psychological. It captures things like energy and sleep and that sort of thing. And we found improvements in lots of those domains. So energy, sleep, psychological well-being, obviously, as well, yes.
You're listening to Wellbeing, and my guest is Dr. Jessica Bays, postdoctoral research fellow at the National Centre for Naturopathic Medicine and Faculty of Health at Southern Cross University. You mentioned that there were varying levels of change. Some people, their score dropped to below 10. Was there anybody who went on the Mediterranean diet who wasn't positively affected by it?
No.
Okay.
Every single person had a reduction in their depressive scores.
Wonderful. So what does this tell you, Jessica, about the relationship between diet and mental health? Begs the question.
I mean, as researchers, we always have to be cautious in what we say. But I think the data is pretty clear that not only can young men with depression significantly improve and change their diets, but that this change led to a drop in their depressive symptoms.
Can you just give me an idea of what they were eating before? How bad was it?
Yeah, so it was things like high in processed food, high in, snack food, high sugar, high fat, low in fruits and vegetables, that sort of thing. I think quite a large percentage said that we asked them, one of the questions was we asked, do you do the majority of the cooking? Does someone else cook for you? Or do you rely on fast food and takeaway food? And a huge percentage just relied on fast food and takeaway food for their meals.
Did they say why? I know it's easy to do. I guess that's the main thing, isn't it? Or was there social pressure to eat that way?
And that's one of the reasons I really wanted to look at this age group as well, not just men, but this age group, because this is when young people are finally taking agency over their lives. They might be moving out of home. They might be living in, university campus. They might not even have access to their own kitchen or their own fridge, that sort of thing. Some of the participants didn't even own, a saucepan at the beginning of the study. So there's all of these sort of age-related changes, people moving out of home and that sort of thing, that impact this population.
Did they all make a positive choice to stay with a diet that was going to keep their mood better, keep their depression down?
Yes. So over the course of the study, we can see that compliance with the diet was very high, and we can also see that that correlates with improvements in their mood. What they did after the study, we don't know, but when we asked them in that sort of feedback survey at the end, sort of the end of trial evaluation is what we call it, almost all of them said, we plan on continuing with the diet. I certainly hope that they did. And I know lots of them, when they sort of reflected back and said, wow, yeah, you don't really notice you're getting better. And then you stop and reflect and think, gee, 12 weeks ago, this is where I was at. This is what my pantry looked like. I now have cooking skills. I now have, cooking utensils. I'm enjoying it, all of that sort of thing. Some of them had negative comments from particularly friends. Now, we know from the research that peer pressure and social stigma is a big issue. particularly in young people and particularly with men. And there's lots of research talking about, particularly around sort of stereotypical notions of masculinity around food and eating. For example, this might be men eat lots of meat, women eat salad, that sort of thing. Mm-hmm. And this sort of, I guess, incorrect perception that a Mediterranean diet meant eating lots of salad, that sort of thing. But once I think the general population, and particularly our young people, learn more about what the Mediterranean diet really is, and that it can be really tasty, really delicious, and it's not just eating celery and that sort of thing, and we start to break down those social stereotypes and stigmas around encouraging healthy eating and that sort of thing, I think things will improve.
Do you have plans to test the approach in other demographics like women or older adults? You say there's already a lot of studies with older adults, but particularly young women.
Yeah, absolutely. So I know of quite a few studies that are in the works, as in they haven't started yet, but they're in development sort of stages in different population groups. Me personally, I am currently putting together, again, clinical trials looking at diet and mental health in adults with autism and also with our military veterans. So again, looking at generally understudied, underserved, vulnerable demographics that kind of need the help the most.
Do you think dietary advice should be a standard part of treating depression?
Absolutely. Absolutely, I do. There is so much evidence building now. Even more studies have come out since the AMEN trial results were published. I know of heaps more that are in the works currently. It's building and building, and it's getting to the point now where the results are very clear. Diet makes a huge impact on mental health and should be standard in discussing treatment options with people suffering from depression.
I don't want to speak for all GPs, but I know that, with the time constraints on a typical GP appointment, it might not be the place to get good nutritional advice. I think some naturopaths provide it though, don't they?
Absolutely, absolutely. GPs only have a couple of minutes and they do not have extensive training in nutrition, let alone nutritional psychiatry. So that's where making it routine that GPs make referrals to nutritionists, naturopaths, dietitians, whoever it might be that has specific training in nutrition and mental health. So I know that is the case for naturopaths and nutritionists. Dietitians not so much, but there are specific courses that they can do to do additional, look into that further. And I think that really needs to be the norm so that patients have access to detailed, specific, one-on-one assistance.
It sounds like this should be in the toolbox of every GP and psychologist as well.
100%, yes.
Yeah. What advice would you give to someone struggling with depression who's hearing us now, who wants to improve their diet? They're inspired by what they've just heard. Where should they start?
I would tell them to go slow. Don't feel like you need to overhaul your entire diet overnight. Just pick a few things that you can do. Because if you're suffering from depression, you probably also have low energy, your sleep isn't great, you have low motivation, and setting yourself up with, I'm going to completely change to a Mediterranean diet overnight and then not being able to fulfill that goal can then be a bit disheartening. So I would say to pick a few small things that you can do and start there. So that might be something really simple, like switching over your white bread to brown bread, adding an extra serve of veggies in, that sort of thing. And I would also say to make changes that you enjoy. So if you're going to add in extra vegetables, for example, choose the ones you like. Don't punish yourself. Don't make yourself eat the ones that you don't like. You want to set yourself up to succeed and make it as easy as possible and delicious, of course.
That harks back to what Drew was saying at the top of the program, where he was saying just eat more of the things that are good for you that you like. Within reason.
Absolutely.
You don't want to overeat on nuts because then you're getting too much fat.
No, you don't want to do that, no.
In fact, you really don't want to overeat on anything.
It's all about balance.
Balance, okay. So you're on a very exciting track by the sound of it, Jessica, with further research. That'll be interesting. Perhaps we could talk about that down the track somewhere.
Absolutely.
Much appreciated. Thanks for your time.
No problem. Thank you for chatting to me.
I've been talking to Dr. Jessica Bays, Postdoctoral Research Fellow at the National Centre for Naturopathic Medicine in the Faculty of Health at Southern Cross University, Deputy Chair and Research Officer with Northern Rivers Autism Association, and Executive Committee Member for the Australasian Society of Autism Research. I'm inspired to see what's in the cupboard for a good Mediterranean diet. I'm Graham Wilson, and I look forward to joining you again next week. And all of us at Wellbeing wish you well.